Tonight we're covering a major development in the Ebola outbreak. Until just a short time ago, in fact, Americans could at least take comfort in the knowledge that all the thousands of cases of this deadly virus were discovered outside of our borders. But a late announcement tonight from the CDC just changed that. The first case has been confirmed here in the U.S. Kate Snow is here with us with late details on this case.
Brian, good evening. There have been many suspected cases of Ebola over the past week that turned out to be false alarms, but this man is the first case of Ebola confirmed to be diagnosed at a hospital on U.S. soil. It was confirmed this afternoon in Dallas. At a late afternoon news conference, the Centers for Disease Control Director, Dr. Tom Frieden, sought to reassure Americans that a case of Ebola discovered here in the U.S. is not cause for alarm.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
Frieden said the patient, who is not being identified, left Liberia in West Africa on September 19th, arriving in the U.S. on the 20th. The patient had no symptoms when he left Liberia or when landing stateside, but 4 or 5 days later, he started feeling sick. He sought care last Friday, but then went home. Then 2 days ago, he was admitted to Texas Health Presbyterian Hospital in Dallas. Since the man was not symptomatic on the airline, he would not have been contagious at that time, Frieden said. The CDC does not believe anyone who was on the flight with him was exposed.
It is certainly possible that someone who had contact with this individual, a family member or other individual, could develop Ebola in the coming weeks. But there is no doubt in my mind that we will stop it here.
Now the CDC will try to piece together who did come into contact with the man and when.
We identify all people who may have had contact with the patient while he could have been infectious. And remember, Ebola does not spread from someone who's not infectious.
The patient was visiting family here in the U.S. Doctors say he is critically ill in intensive care and in isolation. A hospital official said just a week before this patient came in, they were preparing for Ebola. They say they know how to isolate infectious diseases. They have had the training, Brian.